Hello all, hope you all are doing good. Today's session is the 90th webinar on Mitra. A very warm welcome to everyone. The topic for today's session is Integrated Listening Systems, and the topic is presented by our esteemed professional, Dr. Samraj Johnson. Dr. Samraj Johnson is occupational therapist, sensory integration therapist from USA, professor at Osmania Medical College, and he's founder of Kite Science USA and founder of Kite CDC, Hyderabad, India. Sir, a very warm welcome to you on our forum and looking forward for this topic.
Yeah, hi Saujanya and hi all the parents, and happy to meet you all back. Hope all of you, the series what we have continued was in terms of all the interventional modalities available, or the different terms and different modalities so which are there in the field at present is what we have been discussing. So we started we started this series with understanding reflex integration therapies. So in that we have spoken about MNRI techniques and reflex integration, and what is rhythmic movement training. And coming to the parallel side of it, the other terms which we come across and which we hear, and many of the parents who are going through this kind of programs, or many of the parents looking forward for taking this kind of programs, keeping them in view, we thought that we wanted to enlighten certain facts and certain evidence-based studies on it, and how they have evolved and what is the theory behind it is all about these webinars, for you to understand for what you are going, and how much benefit you can get out of it, and what exactly they mean for you and for your child, and the implications of it in terms of the time, in terms of the money you spend, and in terms of the time of the child and progress of the child. So let us I think the topic which we have taken for today is integrated learning systems, I think, is what is being posted. But on a broader spectrum, let us really look into listening therapies. What are all these listening therapies about? So when you talk about listening therapies, predominantly four things come to my mind. One is Tomatis method, one is auditory integration method, in other words Berard method, and the listening program, and the therapeutic listening, and then comes your integrated listening system. So when we talk about listening, I guess it's pretty much important, because as what Dr. Berard has spoken, everything happens as if human behavior were largely conditioned by the manner in which one hears. So it's all about how you hear with your ear, and how that information is perceived, processed, and kept as a memory. So this is all about auditory processing for you. And why auditory processing? Like last time when we have spoken, there is a very close, intricate relationship between auditory processing and the theories which are established in terms of auditory processing, or autism spectrum disorder, auditory processing, or dyslexia, auditory processing, or ADHD. So that this complexity is what made people to do more research in terms of listening therapies, and that's where the complete idea has been evolved. Now, if you are really looking for, let's say, which kind of those signs or symptoms which have been taken together, and which kind of therapy, or which kind of this method, how they have evolved, and to really understand, your child should be first having a set kind of problems, right? And usually they say that these problems could be those who have sensitivity or distortions in hearing, and the signs may include those which go in terms of what we observe as behaviors, would be putting hands over ears, or running away from sounds, or cries in response to loud sounds, tunes out auditory, input as such, acts as if they are deaf, or they are daydreaming, or acts as if there is an attentional drift or inability to stay focused. So these are certain things which appear to be as behaviors, but they say that these are due to that auditory processing, and has history of ear infections or fluid collections in the ear, and they avoid noisy, crowded group situations, and they will have auditory comprehension problems, precisely like when you say, like, they fail to follow spoken directions without a physical prompt or a visual cue, and they does not pay attention to the verbal instructions, and has difficulty with phonics, or displays slow response to verbal stimuli, and frequently they will be giving inappropriate responses in a conversation. You might be talking something, and there will be an inappropriate response from the child, and response to only probably a part of a verbal command. You might have given a two-step command, two-step command to be followed. They might be paying attention only to the one step in it, and then they might stop there and turn and look back for you to again guide them in doing it. And they will be having inconsistency in terms of reading, spelling, writing. In other words, educational performances. Usually they tend to avoid eye contact, or they keep making sounds for the sake of it, humming throughout the day, or making certain noises throughout the day. And usually these children will have problems in organizing themselves. And the most important factor is they fatigue by the end of the day, and has difficulty finding words to express themselves. And all these things eventually turn up to be temper tantrums. And if your auditory processing is not good, bottom line is that speech and language evolution doesn't take place in the child, right? So that's where the total gist is all about. Why auditory processing is considered to be, or why people say that, central auditory processing disorder should be ruled out prior to diagnosing a child with a child on spectrum, or ADHD, or dyslexia. The reason behind that is, if auditory processing is not good, speech and language evolution doesn't take place in the child. And if that doesn't take place in the child, there is already a limitation in communication. And if there is a limitation in communication, child becomes isolated, prefers to be isolated, and definitely social skills are impaired. Now, if you see all this, or if a child is having concerns with auditory attention, he may appear to be at attention deficit or hyperactive, right? Because why hyperactivity there again? Because we always talk about, when we talk about auditory processing, it's all about the inner ear. And inner ear has got this vestibular system embedded in it. So it goes hand in hand, right? Auditory attention, vestibular system, that means auditory processing and vestibular processing together should have to be ruled out before prior diagnosing a child with ADHD. So this is what made the complete. This is where the thesis keeps getting evolved. This is where the researches keep happening, because either for ADHD, or either for autism, or either for dyslexia, or all the pervasive disorders, that category of neurodevelopmental disorders, what we keep talking about, there is no base in terms of why it is, right? So that's where all these hypotheses start coming into picture. Maybe because of this, maybe because of this, the way which we talk about reflex integration, maybe because of reflex integration, or the way people talk about gluten casein free diets, maybe because of the gluten, maybe because of the casein. The same goes with listening programs. The same is with the listening programs, and everybody has got their own theories to support it, own researchers to support it. But if you really look into the evidence of it, none of these theories are evidence-based, because of the sample size, or because of the limited peer study reviews which have taken place. They are not conclusive studies to say that these are proven to be implemented on children. These are all hypotheses and thesis based on their theories and understanding about how it affects, and child development. So now, before we really go into all these kinds of what it means to be, what it means in terms of auditory integration therapy and all that, let us closely look at what is actually auditory processing. When you talk about auditory processing, it is about the sound entering the ear and the way it travels to the language area, right? The way it travels to the language area in the brain and how it is being interpreted. This is what we call it as auditory processing, right? The sound which is entering here and the way it travels and how it is being interpreted in the brain in the language area. If you have to add some terminology to it, maybe it is that representation of acoustic occurrence as it is transformed, coded and recorded in the brain for the process to process this information. And the most apparent response to sound, or the abnormality in responses to sound, they say that is hypersensitivity to hearing. In other words, hyperacuity. That hypersensitivity, which we have just now spoken in the checklist, closing the ears and things like that. And hypersensitivity, individuals will usually know that they over respond to sound or often perceive typical environmental sounds, the normal sounds which won't bother us will become bothersome to them, or they are too loud for these children. And some children have reduced response to sound in their environment, hypersensitivity. So we are basically talking about hypersensitivities and hyposensitivities which can cause disturbance in this processing. And when you talk about auditory processing, it is nothing but how brain interprets what the ears perceive. Simple, right? How brain is interpreting what ears are perceiving and how the brain is interpreting. And with auditory processing deficit, when you say auditory processing deficit, I'm making my point clear. It is not about the hearing capability of the ear. The ears are able to pick up sounds, pick up words, etc., everything, but the brain is not able to process the sounds properly. So ear is taking it, but brain is not processing. That means the way this information is traveling to the language area is not happening the way it should be. And the problems can become more severe if these auditory signals are affected because of distortions, because of the competition in the background, or poor acoustic environments, or reduction in signal clarity, strength, or information content in itself. And this is where, basing on this particular auditory signals and the way it impedes or the way it interferes with auditory processing, or for the child to be having auditory deficits, is where all these theories have established in terms of auditory processing, or in terms of listening therapies or listening modalities which have been used. And because of this component, either whether it is an occupational therapist or a speech therapist or a psychologist, and there are some programs, some methods where you don't have to be a therapist to learn it and implement it on the child. You just have to study certain books of their methods and just procure that certificate, take that equipment from them and start implementing it on the child. But take my words here, there is a process on how it is evolved, and towards the end I'll give you the reasoning for everything. Okay. And as you know, that auditory processing disorder can really show problems in areas of determining the direction of the sound, or difficulty in perceiving differences between sounds and the way they sequence the sounds to make it as a word. So these kind of difficulties usually will impair cognitive functioning and acquisition in language or learning skills. So doesn't it sound very simple? I mean, it really doesn't require a medical knowledge to really understand this logic or the concept. It is a common man's perception also. We can easily grab it. See, point is very clear. If my ear is not taking the signals properly, or after taking the signals, if it is not been traveled properly to the brain, that means nothing is happening with my ear, or nothing is taking place after my ear has heard it in the brain is not interpreting. So our outcome is what? Outcome is that there is no cognitive functioning, there is no proper cognitive functioning development, or there is an impairment in language and learning skills. So Now I'll tell you how it has been the interesting factors of link up between auditory processing and ASD, auditory processing and dyslexia, auditory processing and ADHD. Now, when we talk about ASD as such, we very clearly know that it's a complex developmental disorder that will lead to dysfunctions in cognitive, emotional regulation, and communication skills. Right, number one part. Let's just see point by point. And when you talk about dyslexia or a specific reading disability in children, it is defined as nothing but unexpected difficulty in reading in relation to their cognitive ability and education, right? And problems in discriminating sounds within a word. This discriminating sounds within a word or phonemes, right? Phonemes, a key factor in their reading and spelling difficulties, right, which is a key factor where they'll have difficulties in reading and spelling. And now when you talk about ADHD, we know that it's a group of behavioral symptoms that include inattentiveness, hyperactivity, and impulsiveness, right? These are the things which we usually look into. Now when you talk about this, please, what you need to remember is researchers have suggested that although auditory processing difficulties are not linguistic, but they have a negative impact on language development. Okay, if you talk about now children with ASD, they have been noted with a high number of children with ASD. They have been noted with abnormal responses to sound or diminished low level of auditory discrimination abilities across a range of auditory parameters. Across a range of auditory parameters, there is a diminished level of discrimination capabilities, and hyperacuity, as you know, has been found to be very significant sensitivity in these children, right? So that's where the link up with auditory processing to ASD has evolved. And now when you look into dyslexia, it is like when phonological deficit has been measured and this oral impairment linked with the visual problems, they say that that is the crux behind dyslexia according to these theories. Okay, and the studies have shown that they showed auditory perceptive deficits for linguistic and non-linguistic stimuli. So that's where they say that dyslexia evolves in a child, and these auditory perceptive deficits were considered to support a theory of temporal processing deficit. And when you talk about temporal processing, you need to understand that the properties. What are the properties of temporal processing? The brain, the temporal lobe or the temporal processing, which or the language areas or auditory processing where predominantly takes place, it's the order in which they have received, the duration, the relative thinking, and the rhythm involved in it is impaired in these children. That's the reason why they have dyslexia, is what the theory behind that is. And when you talk about ADHD, the relationship is very simple, that children with selective attention, auditory selective attention, may be caused by reduced information early in the processing stream. Like, there is a reduced attention span to the information which is received at the early time itself. Thereby, it's not about child being inattentive, but it is about child is not able to perceive or able to have this selective auditory attention to certain things. That's where they tend to look to you like an inattentive kid. And a pure quality of this auditory signals, as I said, the distortions and all those things, the poor quality of these auditory signals might have effects on later discrimination, especially in the face of complex auditory situations or auditory environments. So this is how the correlation goes. Like, I hope you are in sync with me when I'm talking this. It might sound very complex, but it is very simple to understand. Okay, so that's the relationship between auditory processing and ASD, auditory processing and dyslexia, and ADHD, and that is the reason why these theories, these researches of listening therapies or programs or modalities have evolved. Now, when you look closely into the other component of it, like what's the difference between a common man and a musician? See, they say that a musician, there is a neuroscientific researches based on this. Whatever I'm speaking now, or based on the researches which have taken place based on neuroscientific approaches, and they very clearly state that response to pitch changes during speech in musicians have showed heightened auditory sensitivity in comparison to common man. So the development of the cortex and at the brainstem level, their ability to pay attention to the intricate or intrinsic notes or the pitches is way above in comparison to the common man, is what the research says about a musicians and a common man. And that is the base for all these theories. That is music. Music, the way processing of pitch during speech is important, as we know, in terms of recognizing the identity, the emotion, and the intentions of the speaker, right? That's what is processing of a pitch. Like, whenever you talk, whenever you do, it is all about identifying, it's all about understanding the emotions, and it's all about understanding the intentions of the speaker, right? So it is very clear, very imperative that how pitch plays a role. And that's what they say, the pitch changes which a musician's brain or a musician's brain in terms of development of cortex and at the brainstem level is higher in comparison to the common man, in comparison to a non-musician, in other words. So this is where the history of sound-based theories have developed, the complete history of sound-based theories developed, because as I said, there is a direct connection from the auditory system to the subcortical sensory motor processing centers in the brain. And it, in fact, they say that helps in evolution or helps in connecting the other sensory systems so that a child functions, or there is a multi-sensory processing taking place in these children. So use of processed musical selections or processed musical interventions have been shown to have therapeutic value in sensory disorders. And when we say sensory disorders, I'm talking about ASD, I'm talking about dyslexia, or I'm talking about ADHD. So instead of using all those terms, I'm just using sensory disorders, precisely auditory disorders. Okay, so that's the reason, as I said, many of the therapists will use this kind of musical based intervention programs to aid in developing a proper auditory processing in the child, so that it improves the awareness and there is an improvement in interpersonal skills, body awareness, self-care, and reduces the anxiety in the child. Okay, so at large, what are we talking about? How a child should be performing apt or appropriate in a given social situation, right? So this is how it has been evolved. Now let us see the evolution. Now let us see how this kind of therapy listening programs have been evolved. The first person who has introduced this is Tomatis. Tomatis was the person, Tomatis method. I think many of the parents know about his methods, and many of the parents would have heard or looked into. He is the first person. He is a ENT surgeon by profession, and he has developed this. And there were a lot of theories which he has established in this. And one of the very strong conflicting factor of Tomatis method, according to Berard method, or Berard is the person who has introduced auditory integration therapy. According to Dr. Berard, he says that he doesn't really connect himself with Tomatis method. The reason behind that is Dr. Tomatis in 1950s. In 1950s, this Dr. Alfred Tomatis, what he said is, the way a mother speaks, the pitch of the mother is what changes the auditory processing and the development of auditory processing in womb. That is why the impact of it will be there on the child at the time of birth. That's why autism in that children is what his theory has started with, which was strongly contradicted by many of the doctors down the line and many of the researchers down the line, and they have established that connection does not establish. But for all these listening therapy programs, for the establishment or for the development of these listening therapy programs have taken place based on Tomatis method. And he says that he has developed these new ways of treating atypical behaviors with sound. That is the complete gist of this Tomatis method. He has developed these new ways of treating atypical behaviors with sound, and he regarded ear as a significant sensory apparatus, particularly the inner ear, where along with the cochlea, with relationship to the overall organizing capability of the brain, is what his theory is all based about. And he considered that the voice can only produce what the ear can hear. You can talk basing on only what you hear, is all about his theory. So that's where, if your hearing is not good, that means you don't have expressive language, or you will have certain concerns in communication or socialization. And he has developed this electronically based altered music, and developed the concept of listening therapy, which predominantly involves listening to program exercises, toning the tiny muscles in the ear, or helping to build multisensory pathways in the brain and their ability to process sounds and enhance communication and cognitive abilities in a child. So his theory is based upon what you hear with your ear is what is the production of voice. And with this electronically altered music which he has developed, he says that it will show improvement in listening. It will show in development of the muscles in the ear, which needs to communicate the information to the brain, and it helps overall multisensory processing of the brain. And the very primitive factor, ability to process the sound, will be improved, and overall this will help in enhancing the communication and cognitive abilities in the child. So that is all about Tomatis method or Tomatis technology for you. And if you come to Berard, he was a student under Tomatis, and he really didn't like this concept of Tomatis in terms of what he has spoken, or for the length of the time which Tomatis method has to be used in a day, for number of hours and number of days. He really didn't like that, so he came back. Actually, Berard was a general surgeon by profession, but when he has joined Tomatis to learn this, because he didn't really was in sync with Tomatis, he came out from there. Then he has again went to the medical school, and again joined, and again joined for becoming an ENT surgeon. And after becoming an ENT surgeon, he has taken 5 years of his time in establishing this auditory integration therapy, in other words the Berard method, because of the conflict which he had with Tomatis. And he postulated, this Berard's postulation is all about abnormal sensitivities or insensitivity to certain frequencies of sounds or waves, regardless of the hearing ability of the child. So Tomatis was talking on the same line, in terms of what you hear is what's the production. But what Berard has developed from there is, it is not just what you hear, it is about the acoustic signals which are received by the ear can also cause a problem. So can you see that transformation from one? You will find that relationship in a very beautiful way. So Berard spoken all about sensitivities, treating these sensitivities. And to tell you, all these theories came into existence after one mother, and the child name was Georgia. Child name is Georgie, not Georgia. Child name is Georgie, who was being diagnosed to be having autism. And this mother went to Berard and took his auditory integration therapy. And she came out after the therapy and wrote a book called as The Sound of Miracle. Mother name is Tal. She wrote a book called as Sound of Miracle. A Child's Triumph Over Autism was the book title. I'll repeat it. If you can go, I read that book. If you can really go through that book, mother explained it in a beautiful way of her experiences about the program and how child has overcome this autism. I'll repeat the name of the book, The Sound of Miracle, Child's Triumph Over Autism, written by Stelly. If I'm not wrong, it is Stehli, I think, Stelly. So after that book came into existence, that's where these programs have blown out of proportion, or the importance of these programs have become more evident, or the researchers have become more after that particular point of time. So after that book was released and there was a huge sale of that book and so many parents went through that, so there was too much of curiosity which was created around after she said she overcame autism. A triumph over autism was the term which she has used. So that's where that's the point from where it all evolved. And now, what does Berard do? Berard also uses nothing but electronically enhanced music, but either popular music or classical music that will help in distortions and modulation of sound frequencies at random intervals for random periods of time. This is what Berard's technique, or this is what Berard has done with his auditory integration program. And as I said, they typically use it to correct hypersensitivities or distorted hearing in a child. And in 2013, I think in 2013, if I'm not wrong, studies have shown improvements in areas of hearing acuity, that means hearing capabilities, reduction in sound sensitivities, increased visual tracking, and increased overall mood of the child. Okay. There were some studies which they have carried out in 2013 which came very closely, and I think these studies have been given in you can find these studies in American Association of Audiology, or American Journals of Pediatrics. You can find all these studies embedded in that. And Berard's AIT program, Berard's Auditory Integration Therapy program, is he has invented two devices. He has invented two devices to carry on this program, and I think some of the parents would have bought these devices too, but I don't know which one you have. But he has got two kinds of devices. One is ear educator. Ear educator is one, and the other one is audio kinetron. And basing on all that evolution which has taken place in his studies, he says that this should be utilized for children above 3 years of age. And prior doing that, they say that to rule out ENT concerns, whether wax or whether excessive fluid, and to get magnesium studies done in these children. Prior to looking into it, and the schedule of Berard's program is 20 listening sessions lasting for 30 minutes over a 10-day period, 2 times a day. Right? I think all that you can figure it out, and it should be repeated after 6 months. And if it is a child with autism spectrum, it should be repeated between 6 to 9 months of period. And the most important thing what they say is, once this program is ended, never use that headphones either for any kind of listening purpose, whether it could be a recreational music or for learning or for listening, any other things. Never use those headphones again, is what they say. And the total story is all about re-educating the system to create a smooth and effective route for auditory processing or auditory input. That means they're re-educating the muscles, the way the information which it needs to be processed, the same way in reflex integration therapy too, right? They're re-educating the muscles, so that reflex integration takes place properly. So in auditory integration also, they're talking about the same thing, re-educating the tiny muscles in the ear so that there is a smooth and effective road for auditory input. So everything boils down to same, right? Everything comes very close and boils down to same. That sameness is nothing but child development. The sameness is nothing but child development. This is Berard's AIT program for you. And now, after that, Berard, there are studies after the 2013 or parallelly along with these 2013 studies which have showed improvements in some areas, there are some studies which have come and which have suggested that they found no difference in the behavior, cognitive functioning and adaptive functioning of the child overall. So that means there are two studies. One study which is saying that there are improvements, one study which is saying that there are no improvements. So in summary, what you need to understand is music-based auditory intervention programs have shown improvements in many cases, but not in all. But not in all. That's where the crux of evidence-based, research-based, and approved studies come into playing a role. And if you really look into those parents who are in US, these are still not yet probably established to the line in other countries, in India especially, in comparison to what it has been established according to the Ethic Code 5 in auditory ethics in speech language pathologist ethics or audiologist ethics. They clearly mention that these programs have shown improvements in children, but before giving this program to anybody, they should be explained about the fact that they might not see improvements also, was the clear-cut statement which auditory, the boards which decide on the guidelines of using any kind of program have very clearly stated. So so I'm making my point very clear here. So it is like GFCF diet for you. Some parents who have used it might find improvements, but the same other group of parents who have used it might not have seen even a single improvement in their child. So as simple as that. So whether it is whenever you talk about auditory listening programs or music-based auditory interventions, it's the same story. It's the same story. If it works, it works. That's good for the child. If it doesn't work, it's not working. As simple as that. But it cannot be said that you take this, your child will definitely have improvements, is what you cannot say. Okay. Now, after this, Berad's auditory integration therapy, then came this listening program. And this listening program is done by these people, advanced brain technologies people. They started using psychoacoustically modified. See the beautiful way the terms have been used. One person started with saying what you hear is your voice. The other person came and said that there how you hear also there is a difficulty, and the third person, now the process in which it came is coming to you and saying that psychoacoustically modified. Okay, and they say that by using this kind of listening program, again they say the impact of this will be in functional capabilities of the child, which includes sensory processing, balancing, learning, language, play, and executive function. Now tell me what they left. Nothing, right? Now when it has come up to the listening program, now just from hearing, it has come to the overall picture through this advanced brain technologies, what they have used this by using this psychoacoustically modified classical music. Again, psychoacoustically modified classical music targeting at certain frequencies in the child, and they say that that will give an overall improvement up to the level of play and executive functioning. So that is the third step which has come into the picture, and then came therapeutic listening. Then came the next process which has developed is therapeutic listening, and therapeutic listening has involved complete developmental based and neurological principles. The developmental principles and the neurological principles is what they have brought it together and termed it as therapeutic listening. And this is also a sound-based intervention that possesses implication of optimizing sensory motor functions. So where did it boil down? It has boiled down to child development. That is the hierarchy which we have decided. Reflex integration, primitive reflex integration, postural reflexes development, motor patterns, then comes sensory motor integration, right? So see, the evolution here also is on the similar page. It goes the same way. So here, the therapeutic listening, the documents say that it will optimize the overall sensory motor functioning of the child by showing an impact in areas of their arousal, their sensory modulation, and correcting their sensory motor based disorders. So we have come to sensory motor sensory integration, right? Overall, from auditory processing, you have reached to the factor by providing this kind of auditory stimulus or music based interventions for the child. What are they talking? Finally, they are talking that there is a sensory motor development in the child in terms of arousal, sensory modulation disorders, or sensory based motor disorders, which will automatically enhance social skills and communication in the child. So that is all about therapeutic listening for you. So what they have done is, in therapeutic listening, by the minute they came up to therapeutic listening, these people have involved auditory processing along with the vestibular system. That's where the change, look at the change here now. By listening to this electronically modified music at different frequencies, at different ranges, they have brought vestibular system into it by introducing balance. The program is like that. You will be training the child, you will be giving this program while child is participating in social skills, or the child is participating in communication and balance and navigating space, are learned while listening to this kind of music. And they have established a set standards of music. They go from low frequency sounds, low sounds which are below 1000 hertz, if I'm not wrong, and then the medium, which are between that 1000 to 4000, and then the higher frequency sounds at above 4000 at various times throughout the music track. It's a track which involves different frequencies between this low, medium, and high, where child is keeping it and he is navigating through the space, and he is going through, what do you say, going through balance activities, or is participating in a social skills. So that is all about therapeutic listening for you, therapeutic listening program for you. And now at present it is about integrated listening system, ILS. Now what does ILS say? ILS, it says nothing but it is again built upon this stomatis and the idea that the ear plays a significant role in sensory processing. So crux is same. The baseline for management is all evolved from stomatis, and it considers that this listening program needs to be given along with sensory diet so that there is a complete overall development in the child. And the major difference is to filter it into higher frequencies of music more gradually, and it also uses motor movements like while throwing a ball or doing balance, or while doing eye tracking, and these kind of things is where they use it. That means they're not just using auditory system as a separate entity, but they have included a sensory diet, which means they are considering all the sensory systems together while giving this. And that's where the present state of this therapeutic listening is concerned. So if you closely understand from what I said and from what I've been talking to you, it is all about simple logic that music will have enhancement in terms of development of the cortex and at the brainstem level, and the sensitivities which a person perceives if music is added to them will improve the overall functionality. So that's where it has evolved, and it has evolved through leaps and bounces in that way. But as I said, by using this auditory modalities, or by using this therapeutic by using this listening programs, by using them, by using these listening programs, children have shown improvements, no doubt about it, but at the same time, not all the children. So again, it comes to, is it proven researchers wise, not proven, but children have shown improvements, and at the same set, children have not shown improvements. So I think Sojanya would have cleared their parents' understanding about about all these listening therapies or listening programs or modalities, different modalities which they use. So if anybody has got any questions on this, I'm ready to take it.
Thank you, sir. Thank you so much. Much needed and very informative.
Please understand, we interact with environment throughout our lifetime till we die. So nothing is one time, provided other, like the question what they have asked, if ILS is being used and if other areas of sensory processing are not addressed the way it should be, it is not going to be effective in the child. So you need to consider child as a whole. You cannot consider in terms of, like, no, I'm giving auditory processing, I'm addressing my child with auditory therapy, and I expect improvement or attention span or focus or communication with my child, and not to work on is visual distractions, or not to work on is proprioceptive hyposensitivity, which will not allow him to sit, or not to work upon is vestibular sense, where he cannot maintain balance. So these all work. Please treat your child as a whole. Treat your child as a whole. That's what integrated learning system. Finally, the statement which I made, these auditory programs are effective if they go with sensory diet. What is the story there? That says it will help the sensory processing to become more organized by using this auditory processing and taking into consideration the other areas of concern of child in different sensory processing areas. If you don't consider that, and if you don't treat that, let's say if you don't treat visual distraction, let's say you are not addressing vestibular and proprioceptive hyposensitivity, and just by giving auditory ILS program or different programs, don't expect changes in your child. It will never happen. It will never happen because you are addressing auditory processing, but you are not working on is visual distraction. So once you remove this, automatically child is still having visual distraction, so the inattention will still be there.
Thank you,
Is
sir.
that clear, Saujanya?
Yes, sir. Thank you so much. And this particular listening program doubts on this, and a lot of misconceptions on this, and a lot of posts generally on a daily basis in the groups. I think this webinar will be an eye opener, and I think there will be a proper understanding to many parents. So it's been a very informative session, and it has helped a lot of parents who joined in today. Thank you
And
so much.
lastly, Saujanya, I'm sorry for interrupting.
Yes.
I am not endorsing any program in terms of to take it or not to take it.
Yeah, that's very important. It is just to bring in awareness because this topic has come up many times. So we want to bring forward this topic and explain the better aspects of it. So please take a wise decision when it comes to your child. We always say that, sir. I hope you agree with
Yes,
my
ma'am.
point. So
100%. 100%. See, Saujanya and we are into helping you to understand these terms and decide by yourself on what you need to be doing. We are trying to empower the knowledge in you to understand the complete gist behind all these things, so that you start pursuing your child and so that you understand before you take that program. As I said, I don't endorse, but if you have already you have bought that material or you have bought that device and you have worked on auditory integration and your child has shown progress and suddenly is not showing progress anything after that program, that means there are other areas which you have missed out. So don't expect by buying, this is an add-on in terms of taking your child forward, but not the only means to take your child forward. Thank you, Saujanya.
Thank you, sir. Thank you so much for your valuable time and a wonderful session. Thank you so much, sir.
Thank you.
Thank
Thank
you
you,
so
sir.
much.
Thank you, all the
Thank you,
parents.
sir.
Have a good time.
Thank you, ma'am.
Thank you, sir. Thank you, ma'am.
Thank you. See you all soon.